they're talking about how they can make more money by denying people health care.
Making billions of profits off of the backs of patients, and they should not be allowed to do that.
I see people when they're at their lowest, when the system has failed them, and I'm frankly not surprised. They feel abandoned, they feel exploited, they feel lied to.
Health insurers are parasites on our healthcare system, denying care and stealing from Americans. How did we allow these soulless corporations to take over our healthcare? Why is the US the only developed country that has them? And are they the real reason why our healthcare is so expensive? Beneath the surface lies a very complex iceberg that America crashed into headfirst, a rabbit hole that goes much deeper than you could ever imagine. Insurance companies are just one part of the story. So, where does your money actually go? On December 4th, 2024, Americans rejoiced as United Health Insurance CEO Brian Thompson was removed from life support.
Well, that killing is drawing unexpected reaction on social media. Many people expressing support for the shooter.
If that's not a sign American healthcare has become a dystopian nightmare, I don't know what is. America has a sickness that goes far beyond our bodies. It's called greed. These 7 health insurance CEOs raked in $283 million in just 1 year. How did we allow these people to make so much money off the backs of sick Americans? Let's rewind and examine how we got here. Over 100 years before antibiotics were invented, Congress passed an Act for the Relief of Sick and Disabled Seamen in 1798. The act authorized a tax of 20 cents per month from the wages of seamen to fund medical care for sick and disabled seamen. In 1850, the first accident insurance policies were issued for railroad and steamboat accidents. This was followed by disability insurance offerings in 1911. These policies became the basis for the medical insurance policies that followed. In the 1920s, hospitals began offering policies leading to the creation of Blue Cross organizations that still exist to this day. The path was set for the U.S. to eventually implement a nationwide healthcare system. But World War II and the American Medical Association derailed it. During World War II, companies faced a severe worker shortage as military production soared while many working-age Americans served in the armed forces. The federal government had implemented strict controls on wages to prevent inflation, making it impossible for businesses to compete for scarce workers by offering higher pay. However, a crucial ruling by the War Labor Board created a loophole. Employee benefits like health insurance and sick leave were not classified as wages under these restrictions. Businesses seized this opportunity and began attracting workers by offering comprehensive health insurance and other benefits instead of higher salaries, leading to the widespread adoption of employer-based health coverage. In 1945, President Harry S. Truman proposed the first universal public health care program, which was wildly popular, but the American Medical Association unleashed a campaign to kill the program. Doctors feared it would hurt their earnings. 80 years later, they are paying the price. In 1965, President Lyndon B. Johnson finally signed the Medicare and Medicaid programs into law, creating publicly financed insurance for the elderly and the poor. These remain the only programs entirely publicly funded to this day. In the decades that followed, the health insurance companies that serve America today grew and consolidated into the behemoths they are now. Served is a loose term here, as we all know how often they deny their customers. In J.M. Feynman's book, Delay, Deny, Defend, he explains the method insurance companies use to boost profits. First, they create a delay between the claim and when they pay it out. This delay time, known as float, gives them the opportunity to profit from investing the premiums.
Let's say I'm following a patient's tumor size. We need an MRI to see how the tumor is behaving. The insurance company will deny it. I will call them. I will say the patient needs, why? Because of this. Did you get a CAT scan first? No, they don't need a CAT scan. They need an MRI. No, they do. And I have to argue for 45 minutes.
Second, they deny claims as much as possible and defend them in court if needed. Insurance companies receive no benefit from actually delivering care to their customers. This misalignment of incentives is the reason many politicians have said they shouldn't exist at all.
Healthcare is a right, not a privilege.
Despite decades of pressure from politicians such as Ted Kennedy and Bernie Sanders to create a universal healthcare program that serves all Americans, health insurers have fought tooth and nail to keep their money flowing in. But the crazy part? On average, health insurance companies only make 3% annual profit. 3%. What? How can this be? Surely these evil villains can't only be pocketing 3%. But why are our premiums so high? Don't get me wrong. This 3% still amounts to billions of dollars being stolen from Americans, and they are definitely evil parasites. But, as you'll see in a minute, it only breaks down to $100 per person stolen from your pocket. So, where does the remaining thousands of dollars go? Let's peek behind door number 2, shall we? This is Martin Shkreli. You might know him as Pharma Bro. 10 years ago, he became the face of big pharma corporate greed when he jacked up the price of anti-parasitic drug Daraprim from $13.50 to $750 per pill. Shkreli later went to prison for fraud, but his price gouging was perfectly legal. But this was nothing new. Pharmaceutical companies had been doing this for decades. They just did it in the shadows, while Shkreli did it in the public eye with that smug look on his face. Every now and then, horrific news stories like these would pop up.
For Tom Roylands, it's that time he wishes he could get back.
Hey, bud, how you doing?
And this is not who he ever thought he'd be visiting.
That was Jordan.
His 38-year-old son.
Hard to believe that it's been over a year. I hope you knew you could always call us if you needed more insulin.
So, while health insurers deny you care to your face, they have to pay out wads of cash to an even bigger mafia boss known as Big Pharma. They are the messenger skimming off the top while the mob bosses take home the big pay. Big Pharma lobbies, aka bribes, Congress every year with millions of dollars in political donations.
Drug companies contribute a lot of money to politicians to sway their opinions.
And according to the Center for Responsive Politics, drug companies give 25 times more money to lawmakers than does the NRA.
Why do they pay all this money to political campaigns? They do it to screw you. So, how much is their piece of the pie? Well, it's 7 times bigger than the health insurers. For every $100 health insurance companies steal from you, Big Pharma takes $700 directly out of your pocket. And they let thousands die from lack of insulin, a drug that costs almost nothing in other countries. They claim the money is for R&D, shorthand for research and development of new drugs. But the truth is, many of these new drugs are unnecessary and only made because drugs hitting the generic market are so much cheaper for the general public. Then, they use billions of your dollars to dump into advertising these new drugs. I'm sure you've seen commercials saying, ask your doctor about X drug.
Ask your doctor. Ask your doctor today.
Just talk to your doctor.
Today.
That's their goal. They want to convince you these new drugs are better than the generics. Much of the time, they aren't. Okay, so health insurers steal $100 and Big Pharma steals $700. So, now what? Well, you've probably heard of greedy for-profit hospitals and healthcare providers. But the truth is, on average, hospitals across the board lose money each year. So, while there may be a few shady hospitals, most aren't taking anything from you. What about those rich doctors? The ones that get paid way more than doctors in other countries? Well, first of all, the average medical school debt for a new graduate is almost $250,000. Second, doctors in the U.S. only make on average $50,000 per year during their residency, and they only begin to enjoy the sweet life in their 40s and beyond, which they should. They are saving millions of lives and are among the most skilled doctors in the world. Still, even though they often make double what their counterparts in other countries make with only 1.6 million doctors in the US, this amounts to only $200 million more that we pay. It sounds like a lot, but it's virtually nothing when considering the annual US healthcare spending is over $4 trillion. This amount of money is way too much to comprehend, so let's make it simple. Doctors and nurses in the US charge an extra 50 cents more per American per year than other comparable countries. Would you want to pay an extra 50 cents per year to get a US-trained doctor? I sure would. Okay, so what about that administrative waste we all hear about? Wouldn't getting rid of that save a lot? It sure would. Our bloated administrative work from our complex, disconnected system costs each of us an extra $680 per year. Now, eliminating this system would result in thousands of people losing jobs, but we can transition them to other industries, and we should. These are hardworking people that are working within a system that actively hurts Americans. Let's help move them somewhere else. So that's it, right? We've covered health insurers, big pharma, hospitals, doctors and nurses, and administration. Surely that should cover all our additional expenses. But the math doesn't math. Health insurers steal $100, big pharma steals $700, hospitals take nothing, doctors and nurses take 50 cents, and administration takes another $700. That's only $1,500. But we pay roughly $5,700 more per person per year than other comparable countries. Where does the other $4,200 go? Obesity. Yes, unfortunately it's us. specifically obesity that leads to chronic health conditions such as diabetes, heart disease, cancer, and more. This is why our healthcare is so costly. This is why we get denied so much. We're too expensive to cover, and we all pay for it. Japan has 124 million people, roughly a third the size of the US, yet spends half as much per person and has the longest life expectancy at birth of any country in the world. Now, before you go attacking fat people, it's not their fault either. Food corporations have been brainwashing us for decades that it's okay to eat unhealthy food, even attempting to confuse us on what healthy food actually is. This report shows that even if every American decided to eat healthy foods, we would not have enough supply to meet the demand. How insane is that? So, there you have it. Our healthcare system in a nutshell. What began as an exploration of how health insurance companies scam us led to a much deeper understanding of where our money actually goes. And while health insurers are evil, greedy parasites, pharmaceutical companies are even worse. Our food supplies may just be the worst of all. Thanks for watching. I'm Adam Stein, and this is Future Finance.